Childhood wheezing. Physiologically, any child who has got narrowing of the airway, either triggered by infection or any other environmental trigger, will have this wheezing. What exactly is wheezing? It is the sound produced by turbulence of air when it flows through the narrowed airways, and then that is audible sometimes and sometimes audible only by stethoscope. Now, children wheeze because of multiple reasons. It can be triggered by an infection, which causes the swelling of the airways from the inside, thereby narrowing the airway. Sometimes triggers like cold air, dust, smoke, and even pet dander can cause narrowing of these airways, swelling of the airways, and even spasm of the airways. All these things result in symptoms of excessive cough, sneezing, and a wheeze which is audible through the stethoscope and puts the child in distress. How do we treat it? The basic tenet of treatment stands as trigger avoidance, like your environmental triggers, taking control of dust, making sure you do not stay close to smokers, and also avoidance of pets and taking care of the pet dander. The medical treatment, however, is based on two main premises. One is called a reliever and the other is called a preventer. Both these medications are given through a route of a metered dose inhalers or nebulizations. These medications go directly into the lungs, causes reduction of the spasm of the airways, reduce the swelling within the airways, and also relieve the excess mucus production. At Aster, we pledge to treat you well.